Hi everyone, Assalamu alaikum. I am Dr. Shazeen and today I am here to talk about something we encounter every year, that is flu or influenza. As we head into the flu season, it's crucial to understand what the flu is, how you can protect yourself, and when to take vaccine. So let's dive in.
As you all know, flu is a viral infection caused by the influenza virus that affects the respiratory system, including your nose, throat, and lungs. Symptoms often include fever, cough, sore throat, runny or stuffy nose, headaches, body aches, fatigue, shortness of breath. Some people may have vomiting and diarrhea, though this is more common in the children. Yes, it is highly contagious. It spreads from one person to another through the air. When an infected person coughs or sneezes, droplets can get either onto your hands or move through the air to get into your nose or mouth and then move to the lungs. It can also spread by touching a surface that's contaminated by the flu virus, including the doorknobs, desks, computers, and phones. You are at high risk of complications if you are a healthcare worker, pregnant women, breastfeeding mother, adults older than 65 years of age, children between age of 6 months to 5 years, people with a weakened immune system, caregiver of an older or disabled person, morbidly obese with a BMI of 40 or above, and people who have a chronic medical conditions like asthma, heart disease, kidney disease, liver disease, and diabetes. The best way to prevent the flu is to get the flu vaccine every year. Ideal time for the vaccine is before the start of winter season, that is September or October. So, this is the right time to get vaccinated. Vaccine train your immune system to recognize infection and fight them off before you get sick. Once you receive the flu shot, it takes around 2 weeks to develop the immunity against the virus. Remember, COVID-19 vaccines do not protect against the flu. The recommended age for the flu vaccine is from 6-month-old child to 65 years older or above. All children above 6 months and older should receive the flu shots. From the age of 6 months to 9 years, if you are getting vaccinated for the first time, you have to take 2 doses of the vaccine, 1 month apart. If you are more than 9 years of age, 1 dose is enough every year. The efficacy of the flu vaccine is around 50 to 80%. As you all know, flu vaccines update every year, since influenza is such a virus that rapidly changes itself and the immunity wanes over time. Hence, previous year vaccines are ineffective on the latest strain of influenza. It is due to this reason that every year new vaccines are manufactured and released worldwide. So, it is recommended to get a flu vaccine every year before the flu season. Vaccination decreases the chances of severity of the flu. It decreases the chances of complications and death, as well as it decreases the burden of the society due to flu. Flu vaccines can cause mild flu symptoms, mild fever, pain at the site of the injection, and mild body aches. But all these symptoms last for only 1 to 2 days. The other ways to reduce your risk getting the flu include: wash your hands often with soap and water or use hand sanitizer. Cover your nose and mouth when you cough or sneeze. Avoid being around other people when you or they are sick with the flu or other infectious diseases. Consider wearing mask if you are sick and can't avoid being around others. Avoid touching your face, eyes, nose and mouth. Protect yourself and others. And of course, stay home if you are feeling unwell to avoid infecting others. Get vaccinated now. Now, there are certain myths and facts about the flu vaccine. Number 1, it is not a very serious disease.
Answer to that myth is that flu can be a common problem for the common people, but for the vulnerable population like the children less than 5 years of age, elderly people more than 65 years of age, pregnant mother in the early postpartum period, breastfeeding mothers, And those who have conditions like diabetes, chronic heart disease, kidney disease, liver disease, and asthma, flu can be very serious.
Number 2, flu vaccine itself gives you the viral infection.
The answer to this myth is that you cannot get the flu from the flu vaccine, as the injectable vaccine is composed of killed or inactivated virus, which when injected form antibodies, which can prevent you from the virus, providing a long-term immunity.
And number 3, it shouldn't be given to the pregnant women or the breastfeeding mothers because that can affect the baby.
The fact is that, as per the CDC and WHO recommendation, flu vaccine has been found to be safe for the pregnant and the breastfeeding mothers. It can be given in all the 3 trimesters of pregnancy to protect the mother, the unborn child, and for the infant also, for the first few months after the delivery. So to conclude, I would like to say that flu can be very serious, but with proper precautions like vaccination, good hygiene, and responsible behavior, we can all prevent its spread. Remember, flu vaccine save lives, not just your own, but those of others around you. Stay safe, take a good care of yourself, and make sure to get vaccinated this flu season. Thank you for watching.